It started back in 1988 in Memphis when there was a police shooting involving somebody with mental illness. And they started looking around and going, what kind of training do our police officers have in dealing with the mentally ill? And they realized, not much. So they started a task force in Memphis, and it grew, and they developed the CIT program.
It's a program that teaches officers and people that are in the emergency services to interact with people that are in general crisis and how to identify certain mental health issues that can occur in the field.
That's part of it, the training. The other big part of it is the advocacy. And then the third piece is the infrastructure, which is an assessment site, which is where officers can bring people who are having a behavioral health crisis. You hear CIT is a three-legged stool, and those are the three legs: the training piece, the advocacy, and then the infrastructure.
We put together a few grant applications and finally got some funding from the state to create our CIT program, where we were able to hire a coordinator and put together a local team with law enforcement and citizens and our local jail, College of William and Mary. Since that time, we've added Colonial Williamsburg Foundation. We have military police from some of the local installations around. And we've got really a coalition and a work group.
I was hired to head up formulating our team. We were at the very beginning. And from there, it took off. All the law enforcement agencies in this area. We all came together, got some people trained, and we started putting on our own classes that fall. And when I left back in December of 2015, we trained well over 200 first responders.
And in the beginning, you have a lot of the knowledge presented to you through lecture and other means about learning about mental illnesses and learning about some of the symptoms, learning about medications, learning about the result of some of those medications, what behaviors can happen. And then we will visit sites on the second day. The last days of the CIT, Wednesday, Thursday, Friday, you start going into the 4 coaching plays, you start going into de-escalation techniques, and then you end up going into role-playing. And not only you involved in the role-playing, that's a big learning experience, but when you're actually in the audience too, watching, you're constantly learning too.
I've seen a lot of the scenarios that they do. It's tremendous to see. You know, I know if I took an officer who'd never been through the training, who'd never thought about that, and put them in that same situation when they walk into that room, into that scenario that's created, it's artificial, it's man-made. One of the first things they're doing is reaching for a taser, their spray, the firearm, where now they go into that situation and they're communicating. Unfortunately, there are times when we have to resort to a use of force option, but we're seeing those times being reduced because we can communicate better with folks.
As someone gets kind of stuck in the system longer, it becomes harder to kind of disentangle from the criminal justice and the mental health system. And one of the things the CIT program does here in Virginia, and our program in particular, are the trainees come to Eastern State Hospital for a tour and then an opportunity to speak with a patient or two. And this gives the trainees an opportunity to see what it's like to be a patient. The patients talk about their experience being in the system, and so it really allows the patient to provide a perspective in a training process.
It's really increased the partnership between the mental health community and law enforcement. That's the one thing. First of all, we get to see, we start with the relationship at the CIT class. We get to know the police officers, and they get to know us.
Most of the officers that I've talked to that have come up to me after the training's over and thanked us for putting it on have said that this has really helped me, not only dealing with people with mental illness, but just dealing with people. Police officers' job by nature is confrontational a lot of times. And the techniques that we use, that we train on in crisis intervention training is really focused on being a good listener, trying not to be too threatening, and trying to get the point across to get these folks to do what we want them to do in as nonviolent a way as possible.
The purpose of the assessment center was to try to help ease the burden of law enforcement. Once an individual is placed under emergency custody order, technically law enforcement has to remain with them until the assessment period is over. Well, law enforcement's already working with limited resources. So when you take a police officer off the street to sit with someone for 8 hours in a hospital, that's 8 hours of law enforcement time. They're not out on the streets patrolling and doing the job that they're really supposed to do. The assessment center actually has the capability of transferring custody to release that officer back into the field and allow us to maintain that person in the safe setting of the hospital where we can finish conducting the assessment.
So we have someone from Colonial Behavioral Health embedded in our emergency department. When these people are brought in, the patient or this individual who's in crisis gets kind of a team approach, and it's all, we try to do it as simultaneously, as close together as possible so that we can medically evaluate them to make sure there's no medical emergency, to start looking for placement if this patient is going to be determined that they may be appropriate for inpatient psych care. So it helps with the process versus them being evaluated medically, then they go back and have to be evaluated from a psychiatric standpoint. We're doing everything together in a kind of a triple parallel process so that we can get them expeditiously placed if necessary.
Behavioral health has not typically been something that in an emergent situation that we've done very well because it needs more long-term resolution, and we do things really quick in the emergency department. What I have seen here is a nice merging of medical people understanding the behavioral health side and focusing there, and behavioral health assessments leaning towards understanding medical more and taking those things into consideration, that yes, we've managed their blood pressure, yes, we've got them on these medicines and they should be fine. I think it's the best of both worlds, this program. It's wonderful.
There is a telehealth or a telemedicine link in the emergency room, in a special room. It's been set aside, and it is connected, it is linked to the magistrate's office. We are able to speak face-to-face. The individual or any family member who's needing to speak to the magistrate to witness or swear out a petition or whatever there might be. While that's going on, the documents are entered into that system. They're scanned in, they're sent over. They can be digitally signed and sent back without us going back and forth on this. And all of this is perfectly legal under the Code of Virginia. But it's pretty unique to have the setup to do that. It's one of the greatest efficiencies in our program.
Well, I'm really proud of this public-private partnership, which I think is really an example of how an underfunded, overstressed public mental health CSB system can partner with a private health system and really provide good service. I'm also proud of our data. I mean, when you look at our numbers are really strong. In fact, if you look at the time that we're open, we're the busiest assessment site in the state.
Serious mental illness for many of us who are the family members, especially for the person who's in recovery, it's a long journey for them. I'm going to just use my son as an example. He was going to become an engineer, and his dream suddenly changed when he was struck. And what I want our community to know is that as family members, we're trying to help our loved ones realize a new life. And CIT is very much part of that. They're helping our loved ones to realize that there's value in their lives. So it's a very important part of our system of care, if you want to refer to it that way.
I've had people ask for me by name, knowing that I was a CIT officer, or I've heard of them asking for other CIT officers, and I've heard them saying, all my life I've had a reluctance with police, or I don't like police, but this person actually listened to me. Or I've heard them tell me in the past, you have actually stopped and listened to what I had to say. And I don't get that often.
One of the things that CIT is able to do by training our officers and first responders is this concept of what's called jail diversion. As psychiatric institutions have reduced their bed capacity, persons with mental illness have ended up in jail, and the jails have become the de facto mental health system. It's not just true for Virginia, it's true for many states across the country. And so how CIT can help is when we provide officers and first responders with this information about resources, knowledge about how the system is impacted through these nuisance crime arrests, and thereby overcrowding the jails, they can make an arrest decision.
I think one of the big changes that I see is just the whole officer mentality when it comes to dealing with people that are going through some sort of crisis. The officer mentality now is more, let's get them the help they need, not let's take them to jail. Instead of just trying to solve that issue for that night or that day, I think the officers really do. They're buying into that. They look long term. How can I help this person get the treatment, get whatever they need to keep this from happening again? Not just how do I keep it from happening again today.
We tend to be very understanding of diabetes. We tend to be very understanding of cancer. Very understanding of many chronic conditions that are out there. But serious mental illness, it has become stigmatized over time. We think it's different. But we have to understand that the brain is an organ in the body, just like any other organ in the body. The symptoms manifest themselves differently. Therefore, since people look a little different when they're acting out in front of folks, and they may talk a little differently, and they may behave differently, we can label them, and the easiest thing that society has always been able to do has been to put people away and not see them anymore. That's not okay. CIT creates training, awareness, and alternatives to do it differently and to treat people like the citizens that they are. And I think we're doing a pretty good job of that in this community.